So hi, hello all, welcome to the session. Today in this session we are going to see about the topic of tablet. So tablet is a unit dosage form. The term unit dosage form refers to that it is a pre-measured weight. So we have using the pre-measured weight such as 500 mg, 600, 650 mg. So usually it contains the active pharmaceutical substances such as cetirizine, paracetamol, diclofenac. These are categorized as the active pharmaceutical ingredients. With that active pharmaceutical ingredients, we are using the excipients. We may use excipients or without the excipients, we can compress into the tablet, which are further confirmed as the tablet. So these tablets are further classified into 4 types. The first one is the oral tablet for the ingestion, and the second one is the tablet for the oral cavity, and third one is the tablet administered into other routes, and fourth one is the tablet used in the preparation of solution. So the first one is the tablet used for the ingestion. So it means the tablet we are using it taken it orally. So it is further classified into compressed tablet, multi-compressed tablet. So here compressed tablet we are using only one standard compression force in single compressed tablets. So whereas in multi-compressed tablet we are using different compression force ranging from to low range to higher range. So we are using the multi compressions. So we make the tablet with less friability. And moving on to the enteric coated tablets. So some of the tablet we are taken into the orally, it may liable to the acid hydrolysis. So in order to prevent that kind of acid hydrolysis, we are making coating with the enteric coated excipients such as cellulose acetate. This cellulose acetate protects the tablet from the acid environment and bypasses the acids, and it moves to the intestine. While reaching it to intestine, where it has the alkaline pH. In alkaline pH, the enteric coated get eroded and release the tablet at controlled release. And the fourth one is the chewable tablet. In this type of tablet, which is mainly prepared for the kids, so this type of tablet is orally taken and we make chewable with our teeth. And the fifth one is the film coated tablet. So this type of tablet which are coated with the film forming agent, and the sixth one is the sugar coated tablet. So tablet which has the bitter taste, we are making it more elegant, and then we have masked the bitter taste of the tablet. So we are using the sugar coated tablet, and the last one is the controlled release tablet. In normal conventional tablet, it may immediate release, maybe burst release also, but in conventional tablet it may cause controlled release, which is maintained in the subtherapeutic level to therapeutic range. So we can attain the drug release from the we have maintained in the therapeutic range. And then the second classification is the tablet used for the oral cavity. So tablet used for the oral cavity, it is also similar to that of the tablet used for the injections. So but here is the tablet which are in the oral cavity itself also. It does not passes through the esophagus and into the stomach. So here the tablet is placed only in the oral cavity. The first one is the buccal tablet, and the second one is the sublingual tablet. So and the third one is the torches, and then the lozenges and the dental cones, and the third classification is the tablet administered by the other modes. So here we are not using the oral route. So other than the oral route, we are inserting the tablet into the cavities, such as the implantation of the depot tablet, and then is the vaginal tablets. And the fourth classification is the tablet used for the preparation of solution. So here we have the tablet. That tablet we are not taken as directly into the body cavity. So we have a tablet that is dissolved in a suitable solvent. That solvent we can take in the solution form. So the first one is the effervescent tablet, which usually is contained as a citric acid, tartaric acid, which forms the effervescent agents. So and this is the dispersal tablet, which may have the dissolution time and disintegration within 1 to 2 minutes. And then third one is the hypodermic tablets, and fifth one is the tablet triturate. So moving on to the next topic, evolution of the tablets. So the tablet evolution is further classified as the official taste and the non-official taste. In non-official taste, we are using general appearance and then the hardness. So in general appearance, we are further classified into 2 types. One is the size and shape, and one is the organoleptic properties. And moving on to the official taste, which are usually these are categorized in these are usually normally in the Indian pharmacopoeia or any other pharmacophobias. So the official taste includes the friability, weight variation, content uniformity, disintegration time, and the dissolution time. Further, we are next, we are moving on to the topic of official taste for the tablets. So in this official taste, we are having 5 subclasses. So one is the friability, and one is the weight variation, and third one is the content uniformity, and fourth one is the disintegration, and then fifth one is the dissolution testing. So moving on to the first one, the friability. So the first one is the friability is also tester is also known as the Rochelle friability. Since the 2010 it may be considered as the official test as per the IEP. Before 2010, it is not considered as the official test. So this friability, that is Rochley friability, used to determine the how much of the weight loss during the abrasions. So durability of the tablet to the combined effect of shock and abrasions may be evaluated by the friability. So in case, in order to reduce the friability, so we are maybe increase the upper punch force, or maybe increasing the binder concentration, or increasing the moisture content of the granules. So this friability, Rochley friability, we are placing the tablets in the Rochley friability. So this is pre-programmed operators. So we have to set the speed and then time for the friability testing. So the speed of the friability is determined as the 25 rpm for the 4 minutes. So 25 into 4, 100 resolution per minute. So the acceptance criteria of the friability is not more than 1% as per the IP, and not more than 0.5 to 1% for the USP pharmacophobia. So here we have the formula: percentage of friability is equal to initial weight minus the final weight by initial weight into 100. For example, consider as we are having 500 mg tablet. So we are having the 500 mg tablet. We are introducing that 500 mg tablet into the friability. So when we introducing the 500 mg into the friability, it may revolve 100 resolution. So after the 100 resolution, there may be some of the shock and abrasion imparted on the tablet. So due to the shock, there may be a particle loss in the tablet. So in order to determine, we are using the friability formula. The percentage friability is equal to initial minus final by initial into 100. So we are taking as a 100 mg tablet. So initial weight is 100. The final weight, let me assume after the abrasion we are getting 99 mg, and then my initial weight is 100 into 100. So we have 1 by 100 into 100. So the final output is the 1%. So since the outcome is the 1%, which is usually in the range of 1% in the Indian pharmacopoeia, as per the European pharmacopoeia, 0.5 to 1%. It falls in the range. So this tablet, 100 mg tablet, after the friability test, passes the quality control test. Moving on to the next topic, weight variations. So we have producing lot of tablet, millions of tablet per batch. So in order to check the weight variations, for example, one of the batches have the 500 mg tablet, another batch have the 501 mg tablet. So we have to determine the weight variations present in the tablet during the manufacturing process of the tablet. For that, we are taking, if the tablet we are using in the tablet productions, it may fall in the different categories of weight range. For example, 85 mg, 500 mg, 650 mg. There are different ranges of the weight we are during the production. So we are classifying that weight range into 3 categories. One is the less than 85 mg, and the tablet falls within the 85 to 250 mg, and the tablet falls greater than 250 mg. So we are classifying the weight range according to the tablet size. So this, if we are taking the 85 mg tablet, so that kind of tablet should have the weight variation which may have the deviations of plus or minus 10%. So if we taking the tablet within the range of 85 to 250 mg tablets, so that tablet should have the deviation of the weight variation in the range of 7.5%. So if we taking the greater than 250 mg tablet, such as the paracetamol tablet, 500 mg, Dolo 650 mg tablet, so that kind of tablet may have the weight variation which falls in the deviations of plus or minus 5% as per the IP. So this 85 to 250 and greater than 250 tablets are as per the IP. In case of we are using the USP standards, so in such cases the tablet falls within the 130 mg less than, so that tablet which have that weight variation in the range of plus or minus 10%. So moving on to the next, 130 mg to 325 tablet, we are taking the batch size. We are taking the batch which contains the tablet in the range of 200. So that 200 falls in the range of 130 to 325 mg. So that cases the tablet 200 mg tablet should have the weight variation in the range of plus or minus 7.5%. So in some cases the tablet may be 325 4 mg greater than 324 mg. So in that case, the tablet should have the weight variations of plus or minus 5%. So moving on to the next topic, content uniformity. So in order to determine the content uniformity, we are taking the tablet, usually taking the 10 tablet. So in that 10 tablet, we are taking crushing it with the mortar and pestle. That 10 tablet we are dissolving in the suitable solvent. So after the suitable solvent, we have to filter the solution, and then we have spectroscopy analysis for the content uniformity. So if 9 of the tablet falls within the range of 85 to 115% of content, then it passes the quality control parameters. So if one of the tablet falls within the 75 to 125% of drug content, it may also passes the IP test. So if more than 2 tablets falls within the range of 75 to 125% of content, it may fail to prove the quality control test. So in such cases, we have to additionally take another 10 tablets, totally 10 tablets. So again we are performing this test again and again. So in that 20 tablets, we have to crush it and dissolve it in suitable solvent, and then we have to filter. After the filtration, we are subjected to the spectroscopic analysis such as UV spectrometry, and then we have plot the known concentration with the unknown concentration. With that, we have determined the content uniformity. If again the 20 tablet falls within the, if two of the tablet falls within the range of 75 to 125% of drug content, then it may passes the quality control test. So the search tests are mainly important in order to evaluate the drug content for the tablets. Okay.